Hello and welcome back to the EMJ Gold Podcast, brought to you by EMJ, your number one open access destination for HCPs and pharma globally. Hi everyone, I'm Isabel and I'm really pleased to be back with a special mini-season of the podcast. We're going to be featuring 5 interviews on everything from how the tide is changing in women's health to potential access challenges facing medtech and intensive care. For the first time, we'll also be releasing each episode in shorter, easy-to-digest parts, so you can tune into the topics that matter most to you whenever you have time. To kick off this new series, I'm joined by Rob Stewart, who is CEO of Theramex, a pharma company solely dedicated to women's health. Rob has spent over 30 years in the industry, having held senior roles at Amneal, Allergan and Abbott before joining Theramex in 2020. In this episode, we talk about what inspired Rob's focus on women's health, the role men can play in driving meaningful change, and why governments, healthcare systems and the industry need to work together to improve access and representation for women everywhere. But without further ado, let's get into the episode. So, Rob, first of all, welcome to the podcast. It's a pleasure to have you on today. How are you doing?
I am doing great. It is a pleasure to be here, and I'm really looking forward to spending the time with you to talk about some very, very important topics.
We are indeed, and topics for any of my regular listeners to the podcast, they will know that it's a really big passion of mine. So, yes, very much looking forward to getting into this one. The topic today is going to be women's health. And Rob, this is an area that you're particularly positioned to talk about. So what first inspired you to focus on women's health, and what's kind of continued to drive your interest in this field?
Well, I've been in the pharmaceutical industry for, it's hard to admit now, over 30 years. And within that 30 years, a lot of it has been focused on women's health. I've been in a lot of different organizations where women's health was part of the overall initiative of the company, but wasn't necessarily so solely focused. And within Theramex, this is an opportunity where the company is solely focused on women's health. And it is something that's personal to me, and it's important to me, both from the perspective that I'm a father that has a daughter, and also a mother, and that has gone through pretty significant menopause, a grandmother who died from a cardiac event that was attributed to her osteoporosis. So this is very, very deep and personal to me because again, the environment is changing, and I wanted to make sure that I was part of that dynamic and that change that's happening within the industry.
And as all our listeners will be able to see, you are a man working in this field, which I think there needs to be more men leading in this field. I think there's so much focus, on female founders in the health space, but I think there's ultimately a huge role for men to play. So what steps do you take to properly understand women's health needs and ensure your leadership really authentically reflects those needs as well?
Well, first, by listening. I'm not a woman, so I can't necessarily talk about personal experiences. But what I can do is listen to the stories, listen to the experience, listen to how women are impacted from the various conditions that she faces, whether it be menopause, whether it be even trying to conceive with fertility treatment. And so listening to what a woman's journey is through those different conditions and through different treatment options, and how a woman goes through her understanding of what options are available and why, and having the access and choice. That's what I try to do. I try to really listen. I try to spend time, whether it be in medical congresses, whether it be even participating in community forums, just listening to the feedback, listening to the journey, and then being able to then articulate that back when I'm in different social settings or when I'm standing in front of politicians, because now I have a relatable story that I can share from those different sessions. And I think that's incredibly important. I'll give you an example. I was at a dinner party back around Christmas time. And when the group that we're sitting with, and there was probably about 12 people, uh, we got into the conversation of menopause. And what was so fascinating now is that women are willing to speak about her condition and what she's going through, what works and doesn't work for her, and what different side effects that she may be having from different treatments or lack of treatment. And so, so then, as I'm sitting in the conversation, and then all of a sudden, the table bifurcates, where the men start sitting on one side of the table, and then I'm sitting at the other side with the women, talking about these things. And to me, it's very exciting, and it's great that women are so open and willing to talk about that, not only amongst themselves, but now also with somebody like myself. And then, what was interesting about this story is that we got into a topic of vaginal dryness. And one of the guys who was sitting at the other side of the table just said, are you actually speaking to my wife about vaginal dryness? And I said, yeah, I am. And you should be over here talking about it too. And so that gives me the chance to engage men in this conversation as well. And by the end of the end of that dinner conversation, there was a bunch of guys who were thinking, who are now engaged in this conversation, and came away from that experience thinking differently about what their partner or what their family may be going through. And I think we need to have more of those conversations. I think it's fantastic that women are doing it in their forums, but I think there's a great opportunity for men to participate in this as well.
Yeah, it's not taboo, right? I think for women it felt taboo. For men, it maybe still feels a little taboo, but you're right, it's hopefully heading in the right direction.
It certainly is, and I think it was taboo in the past. When I look at my mother's generation,
Mm.
they went through menopause, and it was essentially a condition that she was just expected to go through. And it's all about aging in their minds, and doctors may or may not be willing to treat. And it was just get over with it, get over with it. It's a fact of life. There's the generation of women that are going through menopause today are completely unaccepting of that answer in that conversation. They know more about their bodies than their doctors do. They are way more open to describing their conditions and their symptoms, and they don't take no for an answer. And they want to live a much better life, a more productive life. These are amazing years for her, and why should she go through it and suffer? And the answer is she shouldn't. And so that's I think is what's great about the time that we're in now is that the generation of women are now much more vocal, much more educated, much more self-sufficient and independent, and want to get control of her body, and are not willing to have access issues or doctors' lack of training stand in the way of that. So I think it used to be taboo, and now it's much more open. And I do think it's still a little uncomfortable for men, and you can see that. But we need to get the men engaged in this conversation in order to finally have some real change and influence in governments, as well as in the industry and employee benefits. We need men to be part of this conversation as well.
Yeah, I couldn't agree more with that. And you touch on governments there. It's no secret that women's health, I mean, I'm speaking specifically in this country, perhaps hasn't been prioritized. The first women's health strategy was within the last 5 years. It's not a priority, even though I think governments will say to female voters that they really, really care about them and want their vote. So why do you think there is this gap when it comes to the societal governmental approach, and how can it truly be closed?
I think there's a lot of different reasons for it. Part of it is financial. Governments are under a tremendous amount of pressures to try and reduce costs. This is, it costs a lot of money. It costs a lot of, it does require lots of resources to be able to fix some of these issues and provide the right level of access. So I think there's an economic pressure. I definitely think that there's other competing priorities as well, such as like governments now trying to increase their spend in defense, given the political uncertainty that we have with the Ukrainian conflict. and other global conflicts. So there's a lot of different pressures that I think are at bear here. But I also do think that this is changing, but it's changing slowly. I think there's a recognition that governments need to appeal to more women voters. I think they're trying to advocate for policies that support it. We did see some things in the UK, for example, in terms of the Women's Health Initiative. A bit of it was window dressing, quite frankly, and appointing a menopause czar during the drug shortages. I think so some of it is a little bit political, but there is general momentum behind some of these initiatives, and I think it's just a matter of staying the course, trying to continue to create that level of advocacy, and make sure that we're noisy in the budgeting processes so that these initiatives do get funded. But across Europe, you see a lot of different initiatives, whether it be in France, a focus on endometriosis. There's even a European commission that's focused on trying to improve access for endometriosis. So there's different initiatives that are going on across Europe. We just have to continue to be loud. Women have to continue to make sure that they're voting for the right candidates that to support these initiatives. And over time, I do think we'll make that change.
Yes, totally agree. Hopefully we will see a change very soon. But I think it's hard to ignore the impact that there already has been on the fact that women's health has been, frankly, neglected for quite a long period of time, talking on the public level for now. You've touched on conditions like endometriosis, menopause. What is the cost of women living today? What has this cost people that it has been neglected, some of these conditions?
Well, I think that the problem that we have is that the governments are set up in different with different levels of responsibility based on how it's organized. It looks at pharmaceutical costs as being one thing. But it needs to look at what's the total cost of not treating as well. How many women exit the workforce because her conditions or symptoms around menopause or endometriosis are so debilitating that she just can't go to work every day. So we have to look at what the totality of cost is, because the treatment aspect is just one part of it. It's the consequence of lack of treatment creates other burdens, but that may be felt elsewhere in the budgetary process. So, for example, the lack of treatment for osteoporosis. 87% of women who suffer from osteoporosis have no idea that they're actually suffering from osteoporosis until they've had their first fracture. Well, when that fracture turns into multiple fractures, what then leads to a hip injury, and now a woman is lying in a hospital bed for weeks on weeks or months on months, or in a nursing home, and the cost to the system is much greater than had they treated earlier in her condition. So I think what we have to do is we have to stop focusing on what is just the cost of a particular medication or the cost of a therapy, over a period of time, but look at what the total cost is of the burden on the economic system, both in terms of employment as well as in terms of hospitalizations and other consequences that may be felt elsewhere in the budget.
And mental health as well. I suppose that's playing a key role.
Absolutely. Mental health is a critical situation here as well. I mean, it's interesting how many women who are suffering from menopause, when they go in and they engage with their physician, because they're having these very, very short engagements with their GP, and the GP has had very, very little training around women's health in general. It leads sometimes to a diagnosis that a woman is depressed, as opposed to if they just spent 5 seconds more, ask 2 or 3 more questions in terms of when was the last period, how irregular has your period been. You could lead to a different diagnosis and a different treatment. And I think that's some of the things that we have to continue to do as well around the educational aspect for what women are going through.
And that wraps up part 1. Thank you for listening. Join us for part 2, where we will continue the discussion.